My name is Dr. Jose Luis Flores, and I'm here to ask all of you to please seek to get vaccinated, and also to answer the question about, is there a religious exemption for the vaccination? And the short answer is no. Religious exemption is designed for people that have any type of discrimination based on their faith, whether it's hiring purposes or whether it's a celebrated day that they need to be absent from work. That's when the patient is protected from that, or the employee. As far as vaccination, all the leaders, including the Pope, are for the vaccine. All the Christian leaders. Why is that? Because there's a myth out there that these vaccines are using stem cells from fetuses for their development. That is not the case for Moderna and Pfizer. There is some question about the Johnson & Johnson, but that's why our leaders, our religious leaders, are promoting vaccination. That's just a myth. God has given you this vaccination to protect you in this pestilence. And the Bible is very clear that He will give you the strength and He'll give you the way. And this is the way. That's a wonderful question, and one that has to be answered. The mark of the beast, it's very clear in Revelation 13. I, as a man of God, I identify as that first, and then as a physician, I read the Bible a lot, and I do sermons. But the mark of the beast is very clearly defined as the number 666 stamped on your hand or your forehead, and it's completely used for commerce, for trade, and for food. The Bible talks about it will be used as a method of getting your food, and without it, you can get nothing. So that clearly has nothing to do with the vaccination. The vaccination is not to promote death. The mark of the beast is. The mark of the beast is not of God. The vaccination is of God. It's a way to save lives. There is nothing in the Bible that talks about a vaccination. Some people are construing it as governmental control. Let's not listen to that. The vaccine saves lives, and there is nothing to have to do anything with the mark of the beast with the vaccine. Fantastic question. The answer is yes, and I'll show you why. The vaccine is developed, and it takes into mind all the different strains that are being exposed in the community, in the world. As time goes on, there's different variants, as we're starting to find out. So if you have had COVID, you only were exposed to the beginning of the infection, the very primordial vaccine, the very primordial viruses. As they develop, these antibodies do not stay in your body forever. They have to constantly be stimulated by more vaccines of the current viruses. Let me show you an example. If I show you this as the first virus, right? And I say, when you see this guy, attack him. That's what I'm telling your body with the vaccine. But if this guy shows up, then your body doesn't recognize him. And so when you're vaccinated, you can see both of them and you'll attack them. When you're not vaccinated, you only see this one. So if this guy shows up, you get sick and it may kill you. So that's a very simple explanation why you should still be vaccinated even if you get COVID. It's a very good question. We're all concerned about our children. The current American Academy of Pediatrics recommends that your child gets vaccinated for the COVID. There's different vaccines from 5 to 11, and then from 12 on up, there's different vaccines. They're very effective. The studies have shown that children with these vaccines do not get sick and do not get hospitalized. Now let me make it real simple for you. They're safe and they're recommended by the pediatricians and also by all of us doctors. And at the same time, it can be given with the flu shot. Let me give you an example why this is why you should give them a COVID shot. If your child went on a field trip, and I tell you that 1 out of 30 children in a field trip would die, you probably would not go on that bus. But if I told you another bus didn't have any deaths in the same field trip, you say, put them on that one. That's the difference between putting your child on the COVID vaccination or not. When they have COVID vaccinations, the children don't die. And up to the date, we have about 300 deaths in children who have had COVID, and these were not vaccinated. So it's a choice of whether you're protecting your children or not, and they're safe, so there really is no reason why not to vaccinate your children.